Welcome to the CTA podcast. Join us as we critically examine the ideological capture of the psychotherapy field. Here we discuss better, common humanity proposals for a fairer society. Our discussions are thought-provoking, and our guests are from diverse backgrounds, bringing unique perspectives to the table. This is the CTA podcast with your hosts, Jaco van Zyl and Christine Siefen.
Today we have Carole Sherwood with us, a psychologist. Carole, tell us a little bit more about what it is that you do and what you're working on, and then we'll talk about the book and how that came to be. It was really fascinating to read the chapter from the therapist's chair. So
Right.
we're excited to hear about that. So tell us a little bit more about your background, and then we'll dig in.
Thank you both very much. Well, I'm a clinical health psychologist, actually, and I worked in the NHS for several years, specifically working with people with HIV, long-term health conditions, cancer, palliative care, and so on, and also trauma. And I left the NHS some years ago now, and then went into private practice for a while. I ran my own practice, and what I'm doing now is essentially supervising. I supervise a counsellor. So I had sort of begun to retire and close down what I was doing with psychology. And what really got me going again was what is going on in the profession at the moment. So I tend my allotment as often as I can, and try to do gardening and nice things, but I'm also sort of dragged back from retirement, if you like, into being interested in what's happening in psychology at the moment.
So we're happy to have you. So what we wanted to hear from is how people came to write, the chapter that they did, what compelled them to talk about that particular part of this conversation, that lens. And also just, when did it appear to be that CSJ was going to be a problem?
I think probably it's best for me to start with how I came to start taking an interest in this again before I started writing the chapter. So I think, like most people back in 2020, with the death of George Floyd and the subsequent BLM protests, what began to concern me was this kind of re-racialization of society. People being labelled, and I just felt a sense of things not being quite right. At the same time, a campaign group called Don't Divide Us set themselves up here in the UK, and I joined them as a supporter, and I've actually been quite active with them since then. And their particular concern was about this critical social justice ideology in schools. And coincidentally, just as I joined, there was a Channel 4 documentary here in the UK called The School That Tried to End Racism. And what I saw on that programme really, really troubled me. They had a group of 11-year-old children who essentially were being indoctrinated with critical race theory. And I watched some of the white children looking really ashamed and guilty. One of them was in tears a couple of times during the first episode. And I watched a girl of mixed heritage who had to choose whether she was black or white in order to go into segregated groups. And the more I watched it, the more concerned I got. And I actually wrote to the British Psychological Society to say, look, what do you think about this? I'm really concerned about this. What is happening when young children as young as 11 are being taught about oppression, and somehow some of them are privileged, some of them are oppressed, and they're teaching them critical race theory? And I couldn't get a reply out of the British Psychological Society at all. I mean, I did get some reassurance that there had been a team of psychologists there and it all been passed through, their checks and balances, but they wouldn't engage with me about critical race theory. And so I thought, okay, I'm not really getting anywhere here. And so I began to get more interested in critical race theory and trying to find out a little bit more about it. And the more I found out about it, the more concerned I got. And I think it's this, the understanding of it and how divisive it is and how illiberal it is.
Right.
It makes people, categorizes people according to skin color. And I thought, okay, if I get an opportunity to write about this, I will. And I did write a couple of pieces for Don't Divide Us, that campaign that I was involved with. And it was actually as a result of one of those that Val Thomas, the editor of the book, saw this and contacted me and said, would you be interested in writing a chapter? And I thought, yeah, absolutely, I would. So this is how I came to get engaged with it, because I think having read The Coddling of the American Mind as well, Jonathan Haidt and Greg Lukianoff have really inspired me in this way. I find that their influence, it really has sort of influenced me in the chapter. They talk quite a lot about the ways of thinking, the kind of cognitive distortion that critical race theory tends to encourage in young people. And so I've really gone along that route and expanded on that. So that's how I came to write the chapter and actually choose that as subject matter.
I just found your approach to the chapter quite interesting and innovative.
Yeah.
To make the content and the character of critical race theory as one of the many critical theories under the umbrella term critical social justice, to characterize it, to create a picture of what kind of character this ideology produces by necessity. In other words, the better you endorse this ideology, the more you will become like this person. And we've seen this collectively, and that this is indeed very troubling. Before you tell us about this critical race theory in a therapist's chair, I want to pause it by saying critical race theory doesn't just categorize people. They do more than that. They do stuff with those categories. They attach all these additional meanings to categories. It's no neutral categorization of people.
It is.
Right?
Absolutely right. Yeah. I agree with this. They demonize people who agree with them. And this is not just people who are white. This is anybody from any skin color who disagrees with them. Is categorized as a bad person. Somebody who doesn't agree with them is a bad person. And it's so close to good and evil, isn't it? This sense of sin. Yes. You know, you're born with original sin. You're born with racism in your blood, and somehow you have to keep atoning for that.
What you just mentioned about original sin. We talked about this actually on one of the other episodes. That this is a religion of sorts. It's turned into sort of this religious, spiritual, or lack thereof, I don't know, but it's not a religious practice in a way that has all the tenets of what a formalized, religious practice may look like, starting with original sin, right? Which is where we start in the Bible. Christianity, even Judaism, starts with at least those first Old Testament. So not to stray too far off, but that idea of being born with the original sin of racism in the blood, it's another religion in a sense.
It's a religion without forgiveness.
Yes.
Yes. There is no atonement for the guilty race,
constantly,
guilty category. Yeah.
And I think what also troubles me is a lot of its proponents, you're in a real catch-22 situation, because if you do try and atone, you're accused of being self-flagellating, or you're accused of being a white savior. So it's a Kafka trap, isn't it? Which you cannot escape from. Yes. So however
you
much
either accept your guilt, you either accept your guilt and you'd be guilty, or you deny your complicity, and your denial in itself would be proof of your guilt. That's a classical Kafka trap, like you said, right? Exactly. And that is based on immutable characteristics,
which you cannot change. You're born the way you are, and you cannot change those characteristics. And in that sense, it's an incredibly pessimistic view of human nature. I feel that nobody is allowed. There's no charity. There's no forgiveness. I just think about one of the things that I used to talk about with clients when trying to kind of understand how there are so many different ways to interpret the same situation. So maybe you're on the tube, and somebody treads on your foot, and you get understandably quite irritated by this and angry, and you start shouting at someone, and then you realize they've got a white stick and they're blind, and you think, oh my goodness, I'm so sorry, and you correct yourself and you say, no, I'm really sorry, I understand that obviously you didn't mean to do that. You don't get that critical race theory. You get this sort of whole idea of microaggressions. Intent doesn't matter. It's all about impact, how it affects the person.
Impact versus intent. Yeah, the nuances of behavior, the nuances of communication, right? How we see the world or how we've experienced other people is completely dismissed because of the rigidity. And we're there trying to help our clients move from rigid thinking, black and white thinking, right? The nature of CBT, cognitive behavioral therapies in general, what it seeks to do is to actually allow space for the gray. And most of what we do as therapists and clinicians, I feel like, at least I did in my practice, and I would talk to my students about this, is that most of the time we're in the gray. There's very few things in life that are black and white. Maybe that's here and here, but all this is gray in your practice and in your development as a therapist and in your life as a human, as a person. Yeah.
But critical race theory is exactly the opposite. Everything is black and white, quite literally.
Yes. No pun intended.
No. Absolutely. And so they are diametrically opposed in that way. Psychotherapy is so different to critical race theory. It takes a sort of non-judgmental view of people. It's very, it doesn't make assumptions, it's very empathic, it's very forgiving. And yet critical race theory is none of those things. In fact, it's diametrically opposed to all of those things, which is what bothers me.
I want to ask you about your approach to this paragraph, or to this chapter. Isn't it interesting how critical social justice and its variants, they posit themselves as a totalizing ideology, as the answer to everything. And it's interesting how they equate everything else to critical social justice. A person would say, I have a problem with critical race theory. And then an adherent of the theory would say, but you need to respect history. A person would say, I have a problem with critical race theory, and the response would be, yes, but there is racism in the world. And no alternative is permitted, because if an alternative is tolerated, they would tolerate the perpetuation of oppression, and oppression to them is akin to genocide, and you'd be complicit in this genocide and this oppressive regime that they're trying to fight. So they equate CRT to history. They equate CRT to non-racialism. They call it anti-racism. I don't want to use that word because anti-racism isn't what it says it is.
No, it's not.
There's another example. To oppose racism, you have to have CRT, as if that were the only lens through which that could be opposed.
No, that is true. It was very interesting. I was listening to Jonathan Haidt talking about the sheriff studies, with the boys that go off to camp. They are divided into two groups, and they immediately start giving themselves names, becoming very tribal, very competitive with each other. And when the two groups are asked to play a game together, all hell breaks loose because they're tribal. This is what they do. And there's a lot of conflict. And then the experimenter decides that they want to try and bring them together again. And so he gives them a joint task. So there's a lorry with water for the campsite, which is stuck at the bottom of the road. And the boys have to collaborate and cooperate with each other to go and get water. And after that, they all form this kind of bond with each other. both groups together because they have done something collectively which has brought them back together again. And it's this idea of common humanity, the idea that, you know, even though we may have our differences, when we all pull together and we all cooperate, you know, we can actually work very well together and get social cohesion. But the minute you start putting people into in-groups and out-groups, like you say, Rako, you get problems. And don't we have problems at the moment in our two societies? You know, there's an awful lot of conflict and division at the moment, isn't there?
Yeah, you know, and it's interesting because so, you know, I was working with FAIR. We had, you know, corporate clients that were doing these DE&I, you know, these diversity, inclusion, you know, trainings and whatnot. And the approach that we wanted to present, something that you mentioned earlier, Carole, was this idea that we start from the shared humanity point of view. So what we have in common versus what we have that's different, because what we have that's different, if we look at each other and only judge on that, is going to be, again, this immutable characteristic situation, the color of your skin and the color of your hair and your eyes and whatever. So leading, rather than being race essentialists or gender essentialists or whatever, leading with the shared humanity, and then leaving the space open to have these different, you know, experiences without identifying or labeling flattening. That's something that came up in another conversation we were having, that you flatten people. You don't allow room for nuance and for, you know, different experiences sort of to ebb and flow. And the pushback on this was so significant. We could not break that barrier. It's people were, I don't know if they were hungry for kind of the narrative to be reinforced, and we were coming along and saying, wait a minute, that doesn't have to be the case. It's just fascinating that rational adults, corporate adult, corporate lawyers, all of they're all kind of, the buy-in to it is extremely alarming.
It's a terribly stigmatized thing to be called a racist. Quite so. And we've you know, over the years since the civil rights movement, we have, you know, we've internalized that. Nobody generally wants to be called racist or thought racist. So when this theory comes along and says, right, you know, colorblindness isn't working and we think it's actually contributing to racism, you know, we've got a brand new theory. This is going to work. This is it. This is the one. And if you don't sign up to it, then you're seen as a racist, and you know, you're not doing the right thing. So I do understand why people have bought into it, particularly as it is like a religion. It is like religious belief, and like Yoko says, it's the only lens that you're allowed to see things through anymore. So it's very authoritarian, and the way that it cancels people, you know, I think people are often in terror of losing their jobs.
So how about you walk us through your client? CRT meets a white clinical psychologist.
Excellent.
But essentially, I guess one of the what I think is quite a clever device about this is that Dina Macmillan and I worked on two parts. There are two chapters and they're interlinked. And when I told Dina about this idea that I wanted to do to give CRT a voice, she said, yeah, that's great. And she said, I wonder what critics are going to think of you as a white person talking about this. And I thought, you know, she's got a good point here. And she said, I love this idea. Could we do this, you know, so that you write one chapter and CRT meets a white therapist, and then he comes and meets a black therapist, and just compare the two and begin to tease out, you know, what the issues are, what the assumptions are about, you know, white people and black people, and use that as a device. So I thought that was a brilliant idea. So Dina and I have worked on this together. And so when CRT arrives in the consulting room, he's clearly, or it is clearly really disturbed that they're seeing a white person, a white therapist. And what I'm trying to draw out here are all the assumptions that are made about white people. You know, well, this is going to be a race. You know, I'm not going to get anywhere with this person. They're white. You know, what do they know about my lived experience? You know? So there's a kind of hostility building there already because of these underlying assumptions about white people. And so, and also what I'm trying to get is, what does it feel like as a white person being presented with somebody who thinks they're racist from the offshoot? You know, they've never met you, but they've already made that assumption that you're white and racist. So I was trying to sort of give that impression of how I was really concerned not to upset them, but I needed to take the therapy somewhere. So I tried to engage them and try to sort of suggest, well, what is it like looking for racism everywhere? You know, what effect does that have on? What effect might that have on the people around you? They won't engage. I'm right. You know, you are wrong. You are the racist. You're the one who is in the wrong here. So I would reach a kind of a blank wall. So I'd kind of keep trying to kind of push gently against this wall, and maybe looking at microaggressions and just saying, what do you think? You know, people around you might feel if you kind of keep accusing them of microaggressions. No, not going in. You're in the wrong. I'm in the right. So what I then did is what I would do with clients when I was doing therapy myself, and it's cognitive behavior therapy. You will both be very aware of this, where you present a scenario, an everyday event, which you then try and help the person understand that it's possible to see this event or this situation from several different points of view, several different perspectives, several different...
Consider the rest of the picture, in other words.
Absolutely. Let's just look at this scenario. I mean, I can give you the scenario if you like.
Go for it. Go for it.
Yes.
Okay. So just imagine you're walking down the road, and on the opposite side of the road you see a good friend, and they're walking in the opposite direction, and you wave at them and try and make yourself known, and they completely ignore you, and they just keep walking. What would go through your mind then? What would you feel? And often you get, when you do this with a group particularly, you find lots of different reactions. Some people will say, oh my God, what have I done? You know, I must have really upset this person.
Guilt.
They go guilt. They go round and round in their head thinking, you know, what did I say? You know, was there something I done to upset them or offend them? You know, oh my goodness. And they might go home, feel really quite upset about this, and maybe kind of sink into a sort of slough of despair. Somebody else might think, how dare you? You know, you just ignored me. You know, what kind of a friend are you? And you might feel really resentful and angry. And somebody else might kind of get really anxious and think, oh, she doesn't like me anymore. And oh my goodness, how am I going to carry on without this friend? So there's lots of different reactions to the same event. And then what you then say is, well, let's suppose that you found out through a mutual friend that this person that you've just seen walking down the street had just left hospital and discovered they'd got a terminal diagnosis. Just think about that for a moment. How would that change what you thought about that situation? Would you interpret it differently?
Yeah.
So the idea is just pulling this out and just thinking, it's a bit like the blind man on the tube. You know, it's this idea that you might immediately jump to one conclusion, but when you've got more information, you know, you just recalibrate, you stop and you think, yeah, maybe there's another reason why that person ignored me. They just were in their head. Thinking about how CLT responds to that is because they are, first of all, looking at impact rather than intent.
Yes.
This person upset me. I don't care what
doesn't matter.
Well, they upset me. They have to pay. And of course, the other thing is they're looking for racism everywhere. So everything is interpreted through this lens of racism. So there must be some racist intent, even if the person didn't think they were. Unconsciously they were ignoring me. Maybe if they'd seen a white friend across the road, they might have come over and told them what had happened, but no. So there's an awful lot of sort of misinterpretation going on. But of course you can't, it's really difficult to engage with somebody who is so completely taken up with CRT, because they will throw it back at you and say, but this is my truth, this is my lived experience. How can you question my truth? And this is what is thrown back at cognitive behavior therapy. You know, the idea that actually it's being very aggressive, and epistemic violence, I think, is a term that's been...
That's true. That's true. Epistemic violence, yeah.
How dare you question my truth? And of course, there is...
Right.
CRT doesn't allow for objectivity. Objectivity is oppression.
No. Yeah.
So again, it was trying to sort of tease out how would CRT respond to a scenario like that. And of course, they would respond by saying it was racist, and it was, my lived experience. I was extremely hurt. It's their fault. And I'm thinking this is an incredibly uncharitable way to treat your friends, to kind of assume the very worst about them without actually finding out why they're upset.
You mentioned some of these cognitive distortions that they resort to. Emotional reasoning, jumping to conclusions, mind reading. That's a good one.
Mind reading is a very good one, because this is what happens in microaggressions. There's a kind of assumption that somebody means you wrong. Yeah.
So this mindset, this almost this sadistic. It's almost. I get the picture of a gladiator fight.
Yes.
There's bloodthirst, even in the media. There's bloodthirst. Heads must roll. It's
and where
sensationalist.
This piece of being curious and wondering. The entire foundation of practice is to be curious and wondering about our clients. This idea of stereotyping, it goes right back to everything we were taught and told not to do.
Absolutely,
which is stereotype based on what you see in front of you, and groups and traits of those groups that are immutable, maybe not at times, but that's exactly the opposite. So that I'm supposed to walk in and know what that's like, and I can't ask my client those questions. That is extremely dangerous. This idea is getting erased, of being curious and wondering about the client's experience and who they are.
It's absolutely true. It's true. I mean, I can remember meeting sort of white, middle-aged, middle-class women like myself when I was practicing, and had I assumed that they thought exactly the same way as I did and had exactly the same experiences, I would have failed them. I would have utterly failed them. This idea of curiosity, that you keep an open mind, just keep asking questions to find out what this person wants. Who are they? What do I need to know about this person? Not just assume that I know from day one, because of the color of their skin or what gender they are or what sexuality they are, that I know everything about.
It's interesting to see how Carole shows out these various types of cognitive distortions. I'm thinking, for instance, this one subheading where she says all or nothing thinking, overgeneralization, blaming and shaming. What you talked about, Christine, this blaming and shaming, again based on assumptions about immutable characteristics. This victimhood, shoulds and oughts.
And the blaming and shaming leads people to self-censor and to silence themselves. But so there's, as you say, Jaco, I do try and sort of pull out all the various kinds of cognitive distortions, and I think things like name calling and labeling are particularly bad. If somebody doesn't agree with you, if I was seeing somebody for therapy who was behaving like this, I would try and help them to see the effect that this was having on the people around them and on themselves, because it's something. I think of a sort of ancient wisdom that Jonathan Haidt talks about. He calls on ancient wisdom, the idea, I think it's the Buddha who talks about, when you carry around this sort of weight of, I've been so badly abused, and I've been so wronged in my life, and you keep dwelling on it and turning it around and around, you end up really angry and resentful, and this is going to have a really bad effect on your mental health as well as other people.
Absolutely.
And this is what I feel critical race theory encourages people to be. It fosters grievance. It
absolutely
fosters resentment.
It's an entitlement ideology.
Yeah,
it's an entitlement ideology where they cling to a selected trauma. and they
Exactly.
want to take
Yeah.
revenge. They're resentful, and they feel justified. And no behavior. This is something also that we've seen among them. No
Yeah.
behavior among adherents of critical social justice, CRT
Mm,
in particular,
mm.
would be so heinous and so immoral that it couldn't be justified by their victimhood.
Exactly, Echo.
And
This is
that
what
is a formulation of an entitlement ideology, and it's serious. It's scary.
it is scary. It
But I
really
want to
is.
know, this CRT character in
Mm,
your chapter, was
mm.
it a real human being?
No, not at all.
Okay, I was just checking. Okay.
No,
Right.
I mean, no. Dina and I, we felt we had to handle this quite carefully, and we were advised to handle it quite carefully for obvious reasons. And so, no, it was really just looking at the kind of
Yes.
ways of thinking, the cognitive distortions. It was quite easy
Right.
to put together a character, if you like, based on
Yes.
alone, and
We have
just
more than enough material to go by. You just
yeah,
need to observe.
yeah,
Yes.
Observe the news, observe what is reported in the media, observe controversies,
exactly.
observe personal interactions, observe what's happening in on social media, and observe what's happening on campuses, what's being preached on campuses. Read a typical critical social justice piece of so-called research in the social sciences. Even with the Hoax papers published by
Yeah.
Lindsay and his team, then you can construct a critical social justice or a CRT character. And that is what you did splendidly.
Oh, thank you. That's very kind of you.
Yes.
Well,
Yes.
but as I've said, this is not new. The whole idea of cognitive distortions, obviously, because this comes from Aaron Beck and other founders of cognitive behavior therapy, and Jonathan Haidt and Greg Lukianoff have mentioned this in their coddling of the American mind. But I've just tried to expand on it and tried to give this idea of. I think for the reader more than anything else, to help them understand what critical race theory is, what beliefs are, as well as trying to understand the psychological concepts. It felt like this was actually quite a useful device. You could actually see them as a person and begin to see the way they thought, see the way they reacted, see the kind of feelings that it actually brought in you. I don't know when you read the chapter whether it kind of brings out any emotions in you when you read it, but writing it.
Oh yeah, I have a lot to say about that. Because I want to ask you, if you had a client like this, what would be your prognosis?
Not good.
Well,
not good. They would not stay. They would walk out.
No, yes, they would walk out.
They would be there under duress. Dina and I, we've been trying to kind of work on this to create a little animation to try and tell the story of how this might play out for somebody, because we actually think this is quite a powerful way of to get to grips with it, trying to help people understand the mental health problems that are very likely to emerge from thinking in this way. But what is quite interesting, and going back a little way to something I think you said, Jaco, was the when you think about the effects that it might have on white people and the effects it has on people of colour, non-white people. I mentioned in the chapter, Remy Adekoya wrote a brilliant book called Biracial Britain, and he gives voice to a lot of people of mixed heritage in the UK. And what he says is, we all want to be viewed as individuals, not as black people, white people, or mixed race people. We need to approach others as we would like to be approached, as complex human beings, full of so many contradictions. Any label deployed to define us is inevitably gross simplification, which I think is brilliant.
Right.
Absolutely.
Absolutely.
Yeah.
And even in your conclusion, you said, blaming and judging others rather than taking responsibility for your actions, and developing resilience produces a culture of victimhood and division, bullying and abusive behaviors. I like you're referencing even bullying.
Yeah.
It's from this kind of, these kind of communities and characters that CRT is creating that we get the concept of crime bullying.
exactly.
That I'm offended, and now I'm going to obliterate you.
Yes. Yeah.
The inflexible views, lack of compassion, intolerance, or unforgiveness inherent in CRT are, in my view, likely to lead to, rather than reduce, division and racism in society. And I think that is again a stunning binding together, drawing all these threads together, pointing out what effect CRT will likely have on society and communities and institutions, and we're seeing it developing already.
We are. There is evidence of that already happening, isn't there? And I guess that's why I felt this chapter hopefully will give readers the opportunity to engage with this a bit more and think about it a bit more and actually question it a bit more.
Yes, as you were talking like that, I'm just thinking about our communities, our society, and it has to be one of those things that we'd have to consider as a non-negotiable in terms of valuing them as sacred. Because if our communities fall apart, individuals will fall apart, and we will be contributing to suffering. And I think it has been this whole critical social justice movement has run roughshod over our communities, and we're starting to see the bad consequences of it. And it's alarming and it's worrying, but we still have time. As long as we're alive, there is hope. And there are courageous people, and I think it's a very courageous stance you've taken. And I want to thank you for your hard work and your good heart and your courage. And thank you also for encouraging so many of us from different backgrounds, of different races and orientations, and to see the way out. Thank you for helping us do that.
No, it's
such a pleasure to have you, Carole. Thank you.
Pleasure talking to you.
Pleasure.
Thank you very much.